cardiovascular disease as a leading cause of disability, depression goes unrecognized in more than half of patients presenting with symptoms in primary care, where an estimated 60% of patients receive depression care, studies have shown. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zawan, and today I'll talk about routine depression screening, which may capture underdiagnosed patient populations. Implementation leads to better symptom recognition in older adults, minorities, men, non-English speakers, UCSF-led study shows. Screening for depression at the primary care level could dramatically increase the likelihood of treatments for those who are traditionally undertreated. Racial and ethnic minority individuals, older adults, those with limited English proficiency, and men, according to a new study led by UC San Francisco. The researchers tracked electronic health data of 52,944 adult patients seen at 6 UCSF primary care facilities over a 2-year period. After a routine screening policy was implemented, depression screening rates more than doubled from 40.5% in 2017 to 88.8% in 2019. The researchers reported in their study, which was published in JAMA Network Open. In 2018, they found that for every 100 patients aged 18 to 30 screened for depression, 75 patients aged 75 and older were likely to be screened for depression. For every 100 patients screened for depression, there were 59 Chinese language patients and 55 other non-English language patients likely to be screened for depression. By 2019, statistically significant disparities virtually disappeared for older patients, Black or African Americans, other English-speaking patients, and patients with language barriers. However, screening for men remained relatively low. For every 100 women screened for depression, 87 men were likely to be screened for depression compared to 82 men before the policy was implemented. Our study shows that a systems-based approach can increase depression screening and address screening disparities, said senior author Leah S. Carliner, MD professor in the UCSF Division of General Internal Medicine. Depression screening is necessary but not sufficient to decrease care disparities. Screening may help with poor physician recognition of depressive symptoms, but it must be followed by clinical action, said first author Maria E. Garcia. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.